Hey, it's Denise, and today I am just doing my daily vlog for myself. My topic today will be the vital stem and dysphagia, or maybe it's called dysphagia. It's going to be about my son today, the therapy session that he had today using the vital stem. So the vital stem is just like a electrical stimulation that they're putting under his chin right here, and because he has a trach, they're unable to put it right here. He has dysphagia, which just means difficulty swallowing, and he has the difficulty swallowing due to having an NG tube for over a year and also being intubated for about 2.5 months. He was swallowing before that, and sometimes he does swallow a little bit, but like I said, it's difficulty swallowing. So the treatment for that is the vital stem, or NMES, and I asked his swallow therapist, what could we do to get a stronger swallow or to have him swallowing again? And this is what she has to offer, which is the vital stem. It just seems that when he's swallowing, well, actually he's not swallowing, he's like pulling or holding all of his saliva in the back of his mouth, and then when he's done holding it, then he just lets it come out of his mouth, so it appears that he's drooling. So that's what's happening. He's gonna go to maybe 3 weeks of this, twice a week, 3 to 5 weeks, and then after that they might do a swallow study test to see if there's any improvement. And I asked her today, like, what else do you guys have? And basically she was just saying that this is what they do. This is also like a rehab, because he was swallowing before when he was first born, but then after the trauma he's not swallowing. So this is what they do, and she didn't really have any other like remedies after this. So it just lets me think that after this, if this doesn't work, then he's going to be kicked out of the program, or like basically off of the list of being able to get the therapy, because it seems like therapists are like, if you're not improving, then they don't really mess with you. Because that's basically what I'm getting at, like off of each therapy, like physical therapy, occupational therapy. They're like, if you're not really improving, to hell with you. We'll check in on you once a month and see how you're doing, which kind of is like weird to me, because I feel like if he's not improving, then now we need to take another step and do something else. But it doesn't seem like they really have anything else. It just seems like they're working out of the textbook and this is what they're doing, and if that don't work, then they don't know what else to do. So I sometimes try to research things so that way I can have other options available for him, and I work with him at home. But again, I'm not a professional, so what do I know? And so I'm taking him to the professionals, but I'm not exactly like 100% happy with the therapy, because it just doesn't seem like it's working. I mean, sometimes he swallows, obviously, but then the other problem would be aspiration. So obviously he's probably aspirating off of his own saliva, and he's 2 years old, and so he doesn't get any feeds by mouth. He's G-tube fed, but sometimes I do like a dip test and give him like a taste of stuff, and it doesn't seem to be like he hasn't aspirated yet, thank God. And he's had the trach for like almost, let me see, maybe almost 2 years. Almost 2 years he's had the trach. Actually, it could be 2 years, because let me see, I think he got it in 2019 around this time, like May something, and it's 2021. So he probably had the trach now for 2 years. But before getting the G-tube, he was NG fed for over a year. So now he has like an aversion, and I don't know how they're going to like get this to work. These regular little therapies ain't really working and I'm driving an hour away, sometimes taking me 2 and 3 hours to get back home because of traffic, and for like a 50-minute session. And it just doesn't seem like the therapists are like very optimistic. I mean, this therapist, she's a cool lady and everything like that. She seems cool and she's nice, but I don't know. I just feel like out of all these years that's been going on that people have had this difficulty swallowing, that there should be some other options. So if anybody's looking at this, might have talked about this before, but I'm doing a daily vlog, so I'm probably going to be talking about the same thing sometimes. And if you have any answers, like where else to put the vital stem thing at, let me know. It kind of seems like I could just go on Amazon and probably get my own little ab stimulation thing and put it on it myself or something. That's how it seems, because it looks like that's the type of thing that we're working with. But of course, when you add the medical part to it, then the price gets jacked all the way up. So I'm kind of thinking about getting my own little machine, which I probably already have one, and trying it on him, but the little sticky things don't be working. And also with my daily vlogs, I will be showing you what I'm doing with him to try to help him in his therapies at home. So that's all I have for you right now. I'll talk to you guys in my next video. Have a great day. Bye.